A new study says that First Nations, Métis, and Inuit kids suffer disproportionately from food insecurity to a point that it's an urgent public health crisis in Canada. Lead author and pediatric specialist Dr. Anna Banerjee says in some Indigenous communities, there are children who don't have food for entire days. In other cases, children and youth don't have access to costly, nutritious food, and so their diets consist of less expensive, carbohydrate-heavy options that often lead to obesity. The study says colonization is a driving factor. This is because it disrupted Indigenous sources of healthy food, such as traditional hunting, fishing, and gathering. In addition, the study says intergenerational trauma from residential schools fuels underemployment and poverty that makes it hard to afford nutritious food. Well, joining us now to discuss the study and propose solutions is the lead author of the report, Dr. Anna Banerjee herself. She joins us from the Arctic. Dr. Banerjee, thanks again for your time today.
My pleasure. Thank you for having me.
Now, very interesting study, Doctor. It points to food insecurity in Indigenous communities as being a public health crisis. So can you give us an idea of the extent of food insecurity in First Nations communities, both on and off reserve in Canada, and what all this looks like for kids?
So when talking about severe food insecurity, it usually means that children don't eat. They don't have enough money for food for a whole day. And if you look at some of the studies, so our paper was a review of food security. And we found that in many First Nations communities, more than half the families had food insecurity. If you look at the Arctic, 70% of preschool children had food insecurity, and many of them, 65%, had days where they didn't eat. Children didn't eat all day because they couldn't afford food. In another community in northern Quebec, Nunavik, what we found is that the children in insecure homes were 2 centimeters shorter than in food secure homes. And that is called stunting. That's a third world term. We should not have stunting in Canada.
Some very shocking numbers you're sharing with us today, Dr. Banerjee. It's even more surprising to know that food insecurity has been present for years in Indigenous communities, even before food inflation was a major issue. Why do you think that is, Doctor?
Oh, it's for a lot of reasons. So food insecurity exists because of basically the underlying factor is poverty. It's not having enough resources or income to pay for the traditional foods or market foods. So poverty is the main thing. So when people can't get the food from the environment, traditional or country foods, then they go to market foods. And market foods are very, very expensive in these northern or remote communities, like 3 times, 4 times higher than in the South. And, it's so expensive that the kids end up turning to junk food, such as pop and chips and things like that. And so there's a bunch of reasons. Like good nutritious food is often very difficult to bring up north, and it can be perishable, like lettuce and apples. Like often they're of poor quality by the time they get up here, and they're very, very expensive. So a lot of times children don't have food to eat, or they're having junk food.
And I definitely want to touch on a recent comment inside the study, and that the impact of colonization led to a disruption in traditional Indigenous sources of food from hunting, fishing, and gathering. So what can be done to reestablish these traditions?
So a lot of Indigenous communities are really taking hold of that themselves. They're bringing back the land teachings, the language, the culture, and trying to teach the young people how to gather food from the environment and gather, and to go hunting. It's very difficult sometimes, like for example, hunting, because there can be restrictions or certain registries where people can only hunt so much. But a lot of Indigenous people really prefer, especially in the remote rural areas, prefer the traditional foods. But ammunition is expensive, gas is expensive, very difficult to get out there. And a lot of the elders, they're getting older, and some of those skills are not being handed down to the younger people. So it's very difficult often to get the traditionals, typically much healthier in these communities.
All right, Dr. Banerjee, unfortunately, we only have about 20 seconds left here, but what does all of this mean for our efforts toward Indigenous reconciliation from your perspective? A quick 20 seconds.
There is no reconciliation unless you have health. If we allow children to starve in this country, if we allow communities not to have access to clean water, then there is no reconciliation. And we need to do a better job to make sure that Indigenous peoples have health